Be Well, the channel about whole life wellness. I'm Tom Sult, a medical doctor and functional medicine practitioner.
I'm Elizabeth, a registered nurse and whole life coach.
So, Elizabeth, how did you figure out you had Lyme disease?
I discovered I had Lyme disease when I was actually working as Dr. Salt's scribe. So, a little bit about my journey is I had been in nursing for about 15 years before I started working with Dr. Salt, 15, 20 years. And I had become interested in more holistic medicine and natural healing about a decade or so before I met him. I had these strange yet debilitating symptoms that were really preventing me from engaging in my day to day life. So I had to dig into diets and lifestyle changes and really things that I could do myself because all my testing was completely normal. And so that's how I really came to love medicine, especially functional medicine. I was very interested in functional medicine, discovering the why of our illness and getting to the root causes. Little did I know my root cause, one of my main triggers or factors was Lyme disease. So when I came to start working for Dr. Salt, because mainly of his functional medicine practice, I was doing pretty well. I still had issues with heart palpitations and some brain fog, some fatigue, but I was able to navigate my day to day life with that level of fatigue. And then, of course, the migrating joint and muscle pains. But these are all things that I had learned how to kind of keep them at a level that I could still function in my day to day life. But I was his scribe, and a few days into being his scribe, I went home and told my family, I was like, I think I have Lyme disease. These patients have all the symptoms that I have been struggling with for years. And I, of course, kept that information to myself for about another 6 months before I talked to Dr. Salt about it. And it was actually, we discovered I had Lyme disease after we discovered my 3-year-old son at the time tested positive for Lyme disease because he had also been struggling with these symptoms. So
So tell us a little bit about your son.
my son, he had what we had discovered. So he had food allergies. He had a chronic cough that would keep him up at night, and this cough went on for probably a year. And along with that cough, he was just very irritable all the time, and
I remember you said my sweet little boy
mm-hmm.
has has a real problem. He's just irritable all the time,
Yeah, he
and
was irritable and had these crying fits and tantrums, and I didn't know what was wrong with him. And I had taken him to a naturopath actually, and she had done some testing on him and found out that he had all these food sensitivities. So we had him on the IFM diet, the elimination diet, and then all of his symptoms kind of cleared up. But then, of course, after we started reintroducing foods, we really couldn't reintroduce any foods. He continued to have these severe sensitivities that were affecting his life, along with these other symptoms. And finally, he would break out in these skin eruptions too. And I brought in pictures one day, and then that's when we brought him in to be evaluated because they were like large bullseye rashes all over his
it was
entire body.
classic erythema migrans Lyme disease
Mm-hmm.
rash. Absolutely
Mm-hmm.
classic, all over his body, which indicated disseminated disease. So at what, 3 years old, he already had disseminated Lyme disease.
Mm-hmm.
Yeah. So we started treatment. I don't know. He didn't get antibiotics, did he?
No, just stevia is what we
Right.
treated him, and then we treated his gut as well. And it was a long journey. The first 6 months were hard.
Yep.
And his symptoms would fluctuate, and sometimes I would lose hope that he was going to improve. But then about 9 months in, it was just like things turned around, and now today he does still have some, I think, lingering symptoms from time to time, and he still does have some real true food sensitivities that if we don't keep those out of a diet, we do notice kind of the regression of some of those symptoms.
And this is common for people with Lyme. There's usually some kind of predisposing factor, and sometimes it's issues with their ability to detoxify. Sometimes it's issues with food interfering with their immune response that leads them to be susceptible to chronic infection with Lyme or other bugs. And so we looked for and found those and treated them with herbal anti-Lyme medications. And now, well, just as of a couple of days ago, we skied for 4 or 5 hours straight, and
a couple days in a row.
And when we were done, he was not done. He wanted to keep skiing.
Yeah.
So he's doing very, very well, and as are you doing very well.
Yep, I'm able to take care of my children full time, and I have I own a business, and then I also have this that I do as well, Just Be Well. So I have a lot of things going in my life, a lot of stressors that I'm able to manage in a healthy way, and I think I'm functioning.
So from your perspective as both, a nurse and a coach and a scribe, and having been on both sides of this equation as a patient and as a professional, what do you think it is that's really powerful about this group setting that we do? And, this isn't new. We were doing this in the office live in person, but now we're taking it online. So what is it from your perspective that makes these visits powerful, especially for people who are just really sick and wrung out and don't have, maybe as much energy as they need to get to the office and so on?
Well, one of, I think, the really important things about this group that we're doing, this group of 8 Lyme medical group program, is that we will be having these 8 individuals in a group for the entire year. So personally, when I have done multiple group settings, type of, some have been for different types of healing, not just Lyme disease, but other types of healing in my life. And a couple years ago, especially, I was in a group program with Dr. Deanna Minnick. Yep. And it was a really hard year for me. I was going through a divorce and job changes, and my whole life basically was turned upside down. And I joined this group right at the start of it. And there were so many times that I just really couldn't even participate in it. I couldn't speak, but just being present in it. I feel just overall being involved in that community really held me. And it was a sacred space for me to feel what I was going through and process these changes in my life. And then also, work with a group and do some of these extra things that she was having us do on the side. So I felt like, and I would email her at times like, I just haven't been able to participate this month, but it's kind of crazy how all these things that are going together, it's like the group is almost carrying me along the way. So, and there's been multiple groups that I've been involved in throughout my life where I really feel that sense of community is such a comprehensive part of that journey.
So many people with Lyme disease are so isolated because of the illness. And the group creates community. And, when you're doing well, they celebrate with you. When you're not doing well, they support you. And it's really, really powerful, especially for Lyme disease, where there is so much social isolation because you're just too tired to, even before COVID and our isolation. I mean, now Lyme disease is like doubly difficult for people. So this program, because it's designed around this group of 8, it's really powerful. And not only is there the group of 8 interactions with myself and Elizabeth, but then there are other groups where your same group of people get together to really focus healing attention. So there's this whole there's multiple levels. There's diet and lifestyle. Then there's medication if necessary. There's herbal treatment, and there's treatment of you as an individual. So the issue here is we have to kill the bugs. That's really important. But your immune system has to be competent to sweep out the last trash, right? And so functional medicine, the power of functional medicine is creating that unique to you intervention that shores up where you need being shored up. If it's under defense and repair or assimilation or energy production or detoxification or, mental, emotional, spiritual issues or, diet and lifestyle and exercise and stress management and all these different things. And I'm preparing to do a big lecture for the Institute for Functional Medicine on Lyme disease tomorrow, actually. And I note in that talk that functional medicine has the ability to create a one in the world intervention for you. In other words, it's not some cookie cutter. It is literally hyper personalized, only for you intervention. Layered on top of that is specific treatment for Lyme, understanding the biology of the bug and the stealth pathology mechanisms it uses to evade the immune system. So that's really our program. I think it's really powerful. I know it's really powerful. As I've said earlier, our average patient, doubles their wellness in the first year, doubles it again in the second year. So that means, on my famous scale that all my patients hate, 0 is can't function and 10 is perfect, vibrant, effortless health. Where are you? Most of my patients start around 3. We double it in the first year, so now they're a 6. We double it again, they're a 10. You can't get beyond 10, so they're not a 12. So, most people with chronic Lyme, it takes about 2 years to get them all the way home. I said average, right? Because unfortunately, I have a few patients who have very persistent, stubborn disease, and it takes us a while to figure out the underlying risks and predisposing factors. But, the vast majority, we get them all the way home. Sometimes we don't make it, but everybody gets better. Would that be a fair thing to say? Everybody gets better, just not everybody gets a complete cure, but the vast majority, I think, do.
And I think one of the reasons why your program or your patients have such a high success rate is your ability to really listen to them. So they get to go and see you every 3 months and sit down and be able to express everything that's been going on with them, and then have you really just listen to them and listen to their stories. And a lot of times when you're on your Lyme healing journey, it can feel like a very lonely place, even if you have a very supportive, compassionate family. It's still a lonely place to be. So I think this added benefit of having the group and having more frequent visits where they're able to see you actually monthly,
every month,
and,
exactly,
and check in with the group weekly, I think that's going to be a huge benefit to this program.
And not only is it me listening, but it's your 7 other people in your group of 8,
right,
who have Lyme disease and completely get it. It's not like, your wife or your husband who really loves you and really wants to believe you, but you look normal. What the heck? Just get off your butt. No, it's not like that. These people get it in a deep, deep way. Just like she gets it in a deep, deep way because she's had Lyme. I had acute Lyme. It wasn't significant. So I don't claim to be a chronic Lyme patient, but I listen every day to people with chronic Lyme disease, and I get it. And so just that deep listening and support is so critical. It actually has been shown that that kind of support alone improves your immune system, your immune response. So that alone is powerful. Now, layer on top of that all of the functional medicine, again, unique to you intervention of functional medicine. Layer on top of that the intervention, understanding the stealth pathology of the bug and how we get around the biofilms and how we get around the persister forms and the antibiotic in different forms and the cysts and the, all of it, the L forms and all of the different things that make Lyme disease so difficult to treat. When we layer all that stuff together, people get better. All right. Anything else you wanted to add about the Lyme program or your Lyme journey?
Nothing that I can think of right now.
Okay. I think we've hit it pretty hard. And let us know if you have any questions. Just respond to this email or this video, I mean, and we will be looking for your questions.
One thing, I mean, this program that we're starting is starting next month in February. So,
Yep.
and we have a few spots left of this program. Right now, we're just doing 8 people.
Yep, 8 people. We have a couple of spots left. And I'm just going to throw it out there. You know, we did a value stack, and everything we're providing is worth more than $24,000. But the cost is under $3,000. So it's an amazing value for 1 year of care. So it's an amazing value. So ask your questions.
And we'll put a link to, I mean, I think in this group we actually have other links and stuff like that.
Yeah, we'll add one to this as well.